you would please everyone take your seat, and let's, the appointed hour has arrived. Let's see if we can get the meeting moved on. It's called to order. You would please join me for an invocation. Our dear Heavenly Father, we thank you for this day. We thank you for your love and your goodness to us and for watching over us and caring for us. We thank you for the opportunity that you've given to us to serve the people of this state. We just ask that you would give us your guidance and your wisdom in all that we do here today and all of the considerations that we make. For we ask it in Jesus' name, for his sake. Amen. Good morning. Good to have all of you here with us today. We have two bills for consideration, one bill for a hearing. Senator Unterman has the Senate Bill 444. She's not able to be with us today. She had another commitment, but Senator Huffstetler is here to present that bill. If you will, Senator, if you want to come, you can go to the podium and present that, and let's get that microphone on. All right.
All right. Well, thank you for having me here today to present this for Chair Unterman. This council was already formed, was already in operation, and code revision somehow overrode it. So I think the question in July was, well, can't code just put it back? But they said that's not how it works. So this already exists and is meeting, and they're having quarterly meetings. This is simply a fix because some party, which I'm not even sure who it was, overwrote the code and wiped it out of existence. That's the short answer. I can talk about Alzheimer's and its $259 billion impact and how that this council is trying to get to early treatment, which saves thousands of dollars. And I can get into those details if the chair wants, but I'll stop now and see what questions there are.
All right. It's my understanding, based on your comments, that this was inadvertently removed from code. All this bill is doing is reestablishing what was already in code.
Correct.
All right. Are there any questions from members of the committee?
Second.
We have a do pass in second. All in favor, say aye. Aye. All opposed, like sign.
Thank you very much, Mr. Chair.
Yes, sir.
You think you know who did it?
I think director right there. We put him on there.
All right, and we have Senator Jackson is here, and we have this is a hearing only. There will be no vote taken, but this is a hearing only on Senate Bill 411. Senator Jackson.
Good morning, Mr. Chairman, members of the committee. Thank you for hearing Senate Bill 411, LC 430766. This is the creation of the Georgia Commission on African American History and Culture. This legislation creates the Georgia Commission on African American History and Culture to discover, documents, preserve, collect, and promote Georgia's African American history, with a primary focus on educating Georgia citizens about the significance of the African American experience in Georgia. The commission will compose of 20 members appointed on or before August 1st, 2018 by the governor, the speaker, the Senate president, and the Georgia Legislative Black Caucus. On December the 31st, 2019, the commission must issue a comprehensive report of recommendations for the establishment or the need for the establishment of a museum for Georgia of African American history and culture. The African American people has been in Georgia for 400 years. And we have a Native American commission, we have a women's commission, a Holocaust commission, a children's commission, a rural health commission, agriculture commission, and many others. And we think it's time that many of us feel that it's time for African American history to study the history of the African American culture and history for the past 400 years as they resided here in Georgia. There is a precedence for this. There's one in Maryland, right now in Baltimore, Maryland. We have a National Museum of African American History in Washington, D.C. The state of Illinois also have one, and there's currently one being built in the state of South Carolina. And I ask for your favorable consideration, Mr. Chairman and members of this committee.
As stated, this is a hearing only this morning.
Yes, sir.
For your presentation. I appreciate that. Are there any questions of the author from the members of the committee.
I have a question for you.
Yes, sir.
Why is this hearing only?
There are many, many bills before this House, many of study committees before the House this year. And I think the study committees, we only pass a certain number of bills out, as you are aware. So the study committees are not the highest priority at this point, but we could very well come back with another meeting to act on this. I'm just at this point, we're just it's a hearing only.
Okay, then to your point, when would we come back to be able to vote on it?
We have another series of committee days next week.
Okay, so are you committing to?
No, sir, I'm not committing to anything. I am simply saying that's an option.
Okay.
All
Thank
right.
you.
Thank you. Any other questions? All right. Thank you so much for the presentation.
Thank
Have
you.
a good one.
Mhm.
All right. Next up, we have Senate Bill 406. Senator Strickland, would you like to come and make your presentation?
Morning,
Good morning.
Mr. Chairman, members of the committee. I bring to you Senate Bill 406. And on Senate Bill 406, what we're doing is we're addressing, making sure we know who are working with the most vulnerable members of our society. So right now, if you are an owner of a nursing home or a long-term care facility, you have to go through a name-based GCIC background check by state law. The problem, first off, is this is just a name-based background check. This does not always cover the actual person that we're looking at. It also is not a federal-based system that will show all the crimes that person may have committed in different states. The second issue we have is this is just the owner. And so what we're trying to get to with 406 is to go in and actually make sure we know who the people are that are actually on the ground in these rooms caring for these patients, these long-term care facilities. And so Senate Bill 406 comes from the Governor's Criminal Justice Reform Council as a recommendation from them. And this bill actually requires and sets up a whole new system through the Department of Community Health to do fingerprint-based background checks for not just the owners of these long-term care facilities, but also all those individuals that are working directly with the patients in the facilities. So if you dive into the bill, you'll see that we actually define, first off, what owner is. And so we're making sure we're actually covering those who have direct ownership management of the facility. It's not someone that's a minority holder and some corporation has no involvement whatsoever in the actual facility. We also in the bill list out, I'll get to that in a second. We also define who the actual people are that have to be covered by these checks are the owners. And these are those folks that have direct access to the patients, as we define that perfectly in the bill. So if you have someone, for example, that is a custodian or someone that's a cook at a facility, they will not be covered by this. But those that are actually in the rooms caring for these individuals will be covered by these checks. And also in the bill, you'll see on page 3, we list out all the offenses that we're looking at. And so what we're trying to do is we've tailored this bill to make sure that if you have committed in the last 10 years, if you've finished a sentence in the last 10 years for one of these offenses that are listed here, starting on page 3, that you cannot actually work directly with patients.
Let me interrupt you for a second. What's your LC number? Make sure we're working off the proper document.
It starts with LC 298020 ERECS. Is that the right one?
Everybody on the right?
Okay.
All right.
All right.
Very good. Thank you.
And so we list out on page 3 the offenses we're looking to cover, and these are all offenses that deal with theft or some sort of assault, something that will be tied to caring for our most vulnerable members of our society. Y'all may have seen some of the news reports. I believe it was in DeKalb County, where there was a World War II veteran that was dying. It was asking for help, and you actually have a video that someone recorded. I'm not sure where the video came from, but it shows these people that neglected this guy, and he actually passed away because of that neglect. And we're trying to make sure we know who these people are who are in these rooms with these individuals, working with them directly. A couple other parts of the bill, towards the very end, I'm jumping around a little bit, but towards the very end, starting I believe it starts on page 13. We also allow not just for the checks through the Department of Community Health for the owners and individuals working these facilities, we also allow for private citizens to use the same system. And let me also back up and say exactly how the system will work. Someone that is hiring someone to work directly with patients or that wants to become an owner of one of these facilities will actually go to the Department of Community Health and request these fingerprint background checks and actually have the checks done by the Department of Community Health. Department of Community Health then, who've committed to basically a 48-hour turnaround on these, will actually give a thumbs up or thumbs down back to the owner or whoever is hiring for these facilities, saying yes, they've passed, no, they have not passed. And you then can rely on that thumbs up or thumb down from the department. And so it's not something that the individual owners, managers of the facilities have to worry with whether or not this check is sufficient. We're relying on the Department of Community Health to actually conduct these background checks. And towards the end of the bill, we get to where private individuals can also go through the same system. So if you have someone going in your home to care for a loved one, you can actually go through the Department of Community Health and also request the same kind of background check as well on those individuals and get the thumbs up or thumbs down as whether or not someone has any of these crimes on their record as well. Built into this bill as well, starting around line 4, this is on page 12, starting on line 388. So since we have a new procedure put in place that we are requiring these facilities to go through, we also have immunity built into this for the facilities. And so if you are a facility that hires someone, you have sovereign immunity. You cannot be sued for negligent hiring based on your reliance of that background check. Again, we're having a thumbs up or thumbs down. And so you're relying on the state, through the Department of Community Health, to tell you whether or not someone has any sort of record, any sort of crime on their record like this. And so you get immunity from being sued for negligent hiring based on reliance on that thumbs up or thumb down. You also have, starting on line 404, a rebuttable presumption for all other claims outside negligent hiring related to the background, criminal background of someone that you hire, saying that you're not negligent if you relied on this process we have set up in this bill here. And so there is that protection, which hopefully, while there is some new costs associated with this, what I was told was around $40 to $50 per background check, what we're probably going to have for a fingerprint-based background check like this. You also have immunity built back in for these facilities to make sure that hopefully their insurance costs will go down with this, because you'll have less lawsuits being filed for negligent hiring, hopefully also negligent retention as well based on this. And with that, Mr. Chairman, also we have Chairman Sharon Cooper, who walked in. She worked on this a lot longer than I have, and she's worked on this for several years in the House, and she may want to add something as well. And if you'd like, I can turn it over to her after y'all have questions for me. Okay.
Yeah, thank you, Mr. Chairman. Sherry Gilligan, how are you?
Hey, Sherry.
Mr. Senator, it's very exciting to have you in front of me. But I did have a question back. Let me find my underlining. So fun when you get it all underlined and then you lose it.
Yeah.
It was on page 5 at line 135 when it talks about this will not be including the healthcare provider, the nurses, the physicians, the dentist. So I'm assuming there's something already over them to make sure that they are taking care of our patients. But could you tell me if that's included in this bill as well, or
Yes.
somewhere else?
So that's not included in this bill, but those people are already licensed by our state, and so they already go through background checks to get their licenses. So someone that's already been checked, has gone through our Secretary of State's office to get a license, won't have to go through this again. That's why they're exempt from this.
Okay, thank you very much.
Thank you.
It's me, Mr. Chairman. Thanks, Senator. I've just got a question on just a statement. I can't find it in here. You said that if I, as an individual, are going to hire someone in my home to do personal care for my parents or loved ones, okay, so I can request this.
That is correct.
So now just kind of help me out. Where do I request it from as an individual in Jasper, Georgia? And then follow up just on that, what am I gonna get back? Am I, as an individual hiring somebody as a personal thing, gonna get the thumbs up, thumbs down? Or am I gonna have the opportunity to see the printout from GCIC?
So I'm going to say this, and if I'm wrong, I'm sure I'll be corrected. You will also get the same thumbs up or thumbs down. So that GCI, or the fingerprint background check is not released to you. Just like the facilities won't get it, you'll actually also get the thumbs up or thumbs down from the Department of Community Health. And I was trying to find where that is in the bill. I just pulled on to the new LC that y'all have. I believe.
Well, I'm okay. I don't need to see it written here. I'm just thinking,
Okay.
where would I get, I mean, where am I gonna go to get this done at?
Can I have someone from the department, Mr. Hood,
Sure.
answer that question? Because I'd be making up the answer, and that's not good.
I'm Joe Hood, I'm Deputy Commissioner at DCH.
Over here, so you can be live.
Good morning, I'm Joe Hood, I'm Deputy Commissioner at DCH. And the way that the caregiver registry, that's the title for that, is envisioned, is that you would go through the same process as if you were applying for a licensed facility. So you would go to one of the entity, the applicant who's coming to you to be employed, you would send them to one of the facilities that's contracted with GBI, and they would send in a fingerprint application through that facility. That would come to the department, and the application would recognize that you are the employer, and they'll be looking for the thumbs up or thumbs down from that individual. You would log in to the DCH website as if you were a licensed facility. It would be a separate, we have to set that up as part of our database to allow for that, but you would log in as that employer and to be able to check that as if you were a licensed facility employer. So that's the concept that we have there, and then you would get a thumbs up or thumbs down on that individual. You'd have to put in some demographic information, social security number, name, what have you, so that make sure that you get the correct response. You'd either get a thumbs up or thumbs down, or if they're not in the system, you'll get that's not available.
Okay, so me as the individual hiring somebody from my mom will have to go to your website, create an account so that I can get a report back. Is that
Yes, sir.
correct?
That's correct.
Okay, thank you.
Number 7. Busily teed up.
If I could have, Mr. Chairman, just one follow-up on these checks. Right now, this is done through vendors, by Department of Community Health, these fingerprint background checks. If you're gonna be a teacher, for example, in our state, you must get the same kind of check done already by law. And these are actually a lot of FedEx locations, and Representative Petrie and I were discussing this yesterday. These are actually at FedEx places around the state, and, excuse me.
UPS.
UPS, FedEx, same thing, right? They're at UPS stores around the state where you actually can go in.
Senator, I guess so.
That's right, that's right. No comment, I won't follow up. That's all I've got to say about that.
All right. Number 8. Tom? Yes, sir. Kirby?
7?
Oh, I'll be 7. There you go.
All right, thank you, Mr. Chairman. Y'all keep talking about this thumbs up, thumbs down. Getting lots of background checks over my career. So what you're saying is you're going to adjudicate those based off your criteria and just tell us if they passed, or, I mean, there's not a thumbs up, thumbs down on a background check. It's information.
Certainly. So the crimes that are enumerated in the bill, what happens is the criminal record comes back to employees at the Office of Inspector General who are certified and eligible to review that criminal record background check. And all they're doing is comparing to what's enumerated in the bill as an exclusionary item for employment and saying you're either excluded or you're not excluded. And then they're placing the decision for that on the website to say they're eligible for employment or they're not, given the criteria that's in the bill. And so they're reviewing that criminal record from FBI and GBI and making that determination. Then, of course, if they're ineligible, the actual applicant can come back to the department and request an appeal, and they themselves have, being at their criminal record, they can receive the information about why that determination was made, and they can appeal that through the Office of State Administrative Hearings, and then we would go forward from there. The judge could make the determination, it's enumerated in the bill, that given circumstances of how long ago that was or what the circumstances were, that's not going to be a problem, and they could give them an okay for hire. So that's an appeals process. We added a provision in there for existing employees that they could not be terminated solely on the criminal background check until an appeal process had gone forward if they so chose to pursue that.
And then in the bill, if I understood what the senator said, 10 years is right now the cutoff after
10 years from the end of your adjudicated sentence, so that would be at the end of any probation or at the end of any whatever that sentence is.
Okay, thank you.
And I believe Representative Petrie had a follow-up in that.
Yes, thank you, Mr. Chairman, and thank you to my good friend for bringing the bill, my former suite mate. And thank you for being here, and Commissioner, Deputy Commissioner, thank you for being here as well. I want to follow up on Representative Kirby just made a very important point that I want to emphasize so that everybody here understands this, and that is that the fingerprint, which will give us an up or down, which is fantastic, excellent. Providers are likely going to continue to have to do other criminal record checks, because here's what you don't get when you get an up or down. You don't get that information that Representative Kirby alluded to. And so as an employer, oftentimes you want to see that information, because even though somebody may be an up, and I know Representative Kirby knows this well as an HR expert, even though somebody may be a thumbs up, that still may not be you still may not want to hire them. And so I just want to emphasize that this new mandate, which is going to add $50 some odd per person, which we need to acknowledge. Many providers, I think providers that really want to make sure they make the right decisions when they're dealing with the most vulnerable population in the state, are going to continue to do other checks to make sure that they do get some data back that they may need to make the best decisions on who they hire and who they don't hire. So I just want to emphasize that is the case, because I think Representative Kirby made a good point. I do want to take the opportunity while Deputy Commissioner Hood is here, and I want to thank him. I want to thank the department for meeting with me and with Representative LaHood and our chairman as well, Chairman Lumsden, on this issue. They have been extremely helpful. We all have the same goal. I believe it is beneficial that we get everybody. We have long-term care categories now that aren't even required to have criminal record checks, as I pointed out yesterday. And so I like where we're headed, but we got to make sure that we think about all of these ancillary issues as we make these decisions. Everybody before you has a map, and I want to say this while the Deputy Commissioner is here. If you'll look at that map, and you'll see in your district, this is currently the outlets to do these live scan fingerprints in the state of Georgia, okay? And I want you to note, you won't have to look very hard to note how sparsely located they are. And indeed, an example I will give you is that in Chatham County, where I am, there's one location. You see two on the map, but there actually is only one. We have close to 300,000 people in Chatham County. We have one location. And so here's what the department has been so helpful, because my chief concern, as the sponsor knows well, has been that this mandate, which is accomplishing a very good goal, a noble goal, the infrastructure does not exist today to do this. The infrastructure, and the Deputy Commissioner is nodding his head. GBI has acknowledged the same thing. Nodding your head, Director. The infrastructure, I want on the record, does not exist to do this today. And so the department has been extremely helpful to emphasize that they have altered the expectation from the RFP so that we will know that before this is implemented, that we're not going to have aides of the lowest socioeconomic class in this state having to travel through 5 counties to get a fingerprint scan and go to work. Because these folks have to work. And they need to work today and tomorrow, not 3 weeks from now and after they find somebody to give them a ride to get a fingerprint. And so the infrastructure to accomplish this is crucial to you accomplishing this mission. And I appreciate that the sponsor has committed to making that happen, and the department is committed to making that happen. And I just want to make sure that, Deputy Commissioner, you can respond to that if you would. I would appreciate it.
Certainly. The map that Representative Petrie is referring to is the current structure for the contractor for GBI today. I believe that's Gemalto. That contract is up for renewal, and they are in the process, days away from what I understand, from releasing the request for proposal to do a new contract, which may or may not be, as y'all know through a competitive contract process, be the current vendor. The existing structure that you see there, the contract terms are for a live scan machine in I think many in UPS offices or something similar to that, every 50 miles. So what we had committed yesterday in discussion is to change that request for proposal to 25 miles. We had other association, I think Nursing Home Association was there and said that was similar in other states. Certainly think that would address what we're trying to accomplish there and make sure that we had access for employers. We've contacted DOS, and GBI is in the process, to my understanding, of making that change prior to release of the request for proposal. We don't believe that that will have a negative impact necessarily. You don't know, of course, in a competitive vendor environment. We don't necessarily think that will have a negative impact on the price of the check or on proceeding. There is competition among vendors to provide this service, and we talked yesterday, this is approximately 50,000 people, if you count existing employees, that would have to have a check by January 1st of 2021. So that is an additional amount that those vendors would have to see that there is a need for that. In addition, just to the comment on the timeliness, this contract will be let and be in place, to my understanding, by January 1st, 2019. That's the concept, that's the time frame for that. So it'll either be this existing one or a new. If it is a new vendor, I just want to make sure everyone's clear. It won't mean that they have to go out and disperse machines. Most likely, you're going to have a vendor who already does this for federal employment or for other purposes. That would be the competitive nature. You'd be an existing infrastructure. But with that being said, January 1st, 2019, then they would have approximately 10 months before even the applicant process starts. This bill is not effective until October of 2019, and that is for new applicants. And then further in the bill, you have until 2021, January 1st, 2021, between that time frame to do existing employees. So this infrastructure should be in place by January, and then following that, of course, this will begin to take effect. And we had purposely, as a department, we had extended that out. Originally, it was 2018. We've changed that to give additional time for infrastructure and for the department to create the things that we need to do with the federal grant that we have during this time frame in 2018 to allow for the caregiver registry. So with all that being said, I feel confident that we'll have the infrastructure in place and have an expansion to allow for these additional applicant prints that are going to be coming forward. I did want to just address the other point that the representative made in regards to what you're going to get. The thumbs up and the thumbs down. My understanding is the federal process, the FBI, when you go to fingerprint background check, they do not allow, except for certified individuals, which the Office of Inspector General will have through a law enforcement certification in conjunction with GCIC, the ability to see a criminal background. So, I mean, no one, in my understanding, in any industry is able to do that. The only thing that you're able to see today is what an applicant returns to you from a name-based check, and that is Georgia only. So if they falsify an identity, then you're not getting back a true background. So that's a false positive. We had several cases of that occur in Georgia. It's one of the reasons that the department is behind this bill. I mean, some high-profile cases that occurred where a nurse stole credentials from Grady and then presented that as her own and was able to with Bobby Christina, was the caregiver for Bobby Christina, and they didn't find out till after that death. The person was never a nurse, never had the credentials. Under this bill, it asked for that fingerprint background check. That also, we had several other cases for personal care homes and other industries where that has occurred. That's what this protects you against. To further that, as the senator pointed out, what you get, so you don't have to do additional diligence on that, is you get a presumptive liability that you have done everything that you should in the hiring process To my knowledge, that doesn't exist in the other industry bills. I haven't seen that in statutory language when we were reviewing for this. So that's a huge thing to protect you from having to do anything additional for your hiring process. And that was put in there purposely to try and protect the industry and give that additional liability protection so that you don't have to do additional things that are unreasonable, getting a nationwide criminal history, which today, as I stated, you're only getting Georgia. 1 in 10 states, we're 1 in 10 states that don't have this process today. To my knowledge, our border states, only Alabama is the only one with us that doesn't have a fingerprint background check. So all those borders, they come across or live in an adjoining state and come over. You're not getting that today, and and there's no protection today in the law, so you're gonna be liable for negligent hiring on that today. If they come and present to you, you run your check, but you're not gonna see something from Alabama, from Tennessee, or from Florida, wherever that may be. So I do think we've done it as much as we can to try and address that, and I feel confident we'll expand that infrastructure.
No, and thank you, Deputy Commissioner. And again, the commitments you've made are why I support you, and I appreciate you've been that helpful. The issue I raised about the additional information is an issue that is not about liability. It's just about wanting to make the best decisions. I think we want to acknowledge that a lot of providers will continue to do other checks because they will want to actually know what the history of this person has been. And I just want to emphasize that. Thank you.
We have some other questions. All right. Representative Fry.
Thank you, Mr. Chair. Senator, thanks for bringing this bill up. This is good stuff. You know, we're judged by how we treat the least of our population, and this is extremely important. And I don't know if I missed it. I don't know these code sections for these violations on line 84. Do you just have a quick list of the items?
I'll address that to the extent I can, and I'll give you the major categories. I don't have them detailed out in front of me, but basically, it's a felony that for theft and fraud categories, for any personal violent category, and then the elder abuse felonies, running an unlicensed personal care home, all those felonies, and then misdemeanors that are associated with heinous crimes for sexual offenses or violence against person, which murder, manslaughter, those sort of things. If there are any misdemeanors that are captured in those violent crimes, are also subject. Now, and we may have, I don't know if there's I can get you a detailed listing if you like, I just don't have it in front of me.
And I'll just tell you the first few, for example, on line 84, that's cruelty to children. Line 85 is neglecting a disabled adult. 86 is exploiting a disabled adult. And it goes down from there, enticing a child, sexual assault. And so it's all things that a lot of it relate to crimes against children because it's very similar. So it's very vulnerable. And also financial crimes as well, taking advantage of these folks. I know we've seen those kind of cases, as you mentioned as well. And so that's the theme of these, but I can get you an exact list. I didn't have in the copy I have here of what each of these offenses are.
Sure.
We're trying to cover everything that might possibly relate to and show propensity to take advantage of someone.
No, that's good. That's what I was looking for. I just didn't want any small mistakes to be caught up into this type of thing.
That's
Thank you
definitely
very
not our
much.
intent.
Appreciate it.
Thank you.
Representative Elam.
Mr. Chairman, really early on, I was concerned about understanding. This is very intimidating reading this. And I'm glad that Representative Petrie weighed in there. That was very, very helpful to me. And I was going to ask my original question, what's driving this? Why are we doing this? But I have a good understanding now.
All right, very good. Number 8.
Thank you again, Mr. Chairman. So as Representative Petrie was talking about the cost of this, is the cost passed on to the applicant, or is it borne solely by the person who would be hiring the applicant? And then a follow-on question, totally different, would be, this is covering criminal background checks, but there is no credit check, correct?
And that is correct. It's criminal background check related to those crimes that we referenced there. And so any sort of additional, are we getting right out of here? It doesn't include any sort of credit check directly. I think that's in my mind, at least a different subject as far as whether or not you care about the credit history of someone working with these people as much as their criminal history. But the first question you had on the cost, so I think the answer would be it depends, and Jesse Representative Petrie might can say this as well, but most likely I'm assuming the potential employee will not be covering this cost, probably something covered by the employer. And my understanding as well, and jump in if you'd like, is we're trying to make sure we cover the actual cost. So that's a direct cost associated with what it costs to get that check done, including that's what the vendor gets as well, to make sure this is not some big new burden on the state as well.
All right.
And
that
then
right?
if I may ask one follow-on question, because we are talking about also providing this background check for people who wanted to hire someone in their home. This is only for the elderly, someone who is defined as 65 or older. So we're not talking about people who may have a special needs, a young adult. We are only talking about someone who is hiring for the elderly.
Yes, ma'am, that's correct. And the purpose behind that is for the FBI check, we have to show a definitive employer and reason. And what we're doing is piggybacking off of the licensed facility, and they're caring for the elderly in those facility types. So in order to make that link together, it has to be limited in our understanding to the elderly employment for the same population that might be in a nursing home or home health or what have you, that you would be employing for someone in your home.
All right, well, thank you very much for your
And
help here.
I couldn't find that section after looking twice, but it actually is page 14. I was looking right at it, but we were talking about earlier, Representative Jaspers. That's where that starts on line 448.
For those of you who are concerned, that is a false alarm. We're good, okay?
All right. We were trying to get out of here. I thought I was saved by the bell. But
No, afraid not. You have a number of other questions,
Okay,
so
we'll try something else.
just stay put. Just stay put. Representative Kirby.
Thank you, Mr. Chairman. Just kind of following up, 118 to 124, you talk about the direct access, and then on 123, you really get into the financial record keeping of the elderly person. Without a credit check, it's not associated with this FBI fingerprint background check. We're only, and you're still only talking about those convicted of crimes. There's a lot of instances where people in need of money have abused the system where they haven't had a conviction until they got caught for doing this to the elderly. Do you think it might be appropriate to put that in there to add a credit check as well?
Let me give my opinion on that, and I think someone else in the room might can weigh in a little more. But these are a lot of times entry-level jobs, and so I think if you start getting too straight and look at someone's credit, it may never be to hire anybody for these positions, and the cost may go up for paying these people that you can hire, and then those costs will be passed along to all of us who one day may have to be cared for, have family members there being cared for. So I think that, and just my opinion is, we ought to leave it with the criminal history. And yeah, you can't, it's not perfect who you're hiring still, but at least we're doing this criminal background check. If you start getting to someone's credit history, I just don't know who you're ever going to be able to hire.
So if I could just add on to that, the other point of that is it's not consistent to my understanding to require that in other background checks. Part of the reasoning behind that is we're covering a wide range of positions here. It could be that you have someone who has direct access to the financial records who's doing trust accounting. You may, as an employer, want to do an additional credit check for that person because their primary duty is money. For the majority of these, my understanding is they're aides at a low salary who are with the patient and don't really have access to funds. I don't know that a credit check, as the senator pointed out, is necessarily going to help you there because so many of them are not going to have credit yet, or they may have bad credit in just because of that socioeconomic class. So with all those reasons, that's why we don't address that. The employer certainly will have to do due diligence depending upon what the duties of that person are before they employ them. And I suspect if they have monetary responsibilities, that'll be done additionally.
Thank you. Representative Bonner, you have a question?
Thank you, Mr. Chairman. All of the majority of my questions were answered. The only one I had was you talked about the sovereign immunity. Ultimately, what is the ultimate recourse for the patient, the customer, in the event the background check does not catch what is intended to catch? I recall the incident with the church shooting where the Air Force should have reported information, but did not. So ultimately, where is the liability and what is the recourse for the consumer?
Yeah, and I use the word sovereign immunity. I was thinking about another bill I've got to deal with later today. But the immunity piece, So if it's a claim that directly relates to the background check, I mean, this is the best check we have, a federal fingerprint check. And so there is immunity for that. And so a claim that's based on reliance on that check itself or negligent hiring, my understanding, unless someone else can speak on this, there's no one you could sue with that. There is immunity for that if this process is followed. And so we are trusting that the best process, again, we have a federal fingerprint process is the process. And so if there's issues with that, I think we have to address the process itself. But that does give immunity for those kind of claims.
Okay, thank you. And then just the second question, you'd also mentioned a time frame for the turnaround on these background checks. You said 24 to 48 hours. Is that actually stipulated in the?
No, that's not in the bill directly, but you want to speak to that?
So we spoke about this yesterday, and the GBI brought forward the average time frame from a turnaround on a fingerprint check that exists today in other industries. It's an hour and 48 minutes that typically from the time that they get the fingerprints to go up to the FBI, come back to them, and then to the department. So we feel pretty confident we're going to turn it around in 24 to 48 hours. Of course, there's exceptions to that if you have holidays or you have weekends, or if they have something that has to be reviewed to make determinations, it may take longer. But on average, that's what we've done. That's what GBI expects. For the child care industry, they had a chart that showed a similar volume that was a phase-in. That's what they experienced there, that they were able to accommodate it, and so that's where we are there, sir.
Okay, thank you, Mr. Chairman.
Representative Cannon.
Thank you, Mr. Chair. Senator, thank you for bringing this bill. I think it will protect Georgians. I do have a few questions. I do want to echo the sentiment of having a list of those different offenses. I think that's an important piece for us to be able to look at. Mm-hmm. There are a number of different effective dates within this bill. I understand it's pretty omnibus, but they date back to 2009 all the way to 2019. So can you help me understand some of the different effective dates?
Do you want to speak to that?
Sure, I'd be happy to.
Mm-hmm.
The 2009 dates that you're referencing are in the bill are existing law. What we're doing here is we're consolidating things that are in 3 different locations. We have checks today for owners and directors of different facilities, and those are in statute in 3 different places. So we're removing 2 of those code sections where those exist, and where we had things that we had to retain, they're restated in this code section, which is, as you stated, accomplishing all of those for all those facility types. So when the department merged some of its responsibilities for long-term care licensing from the Department of Human Services, that came over, that was in the 2009 timeframe. There was this caveat that was put in there that all those duties that existed prior to that were at the Department of Human Services, who was previously licensing in one specific facility category, now we're with the Department of Community Health. And Legislative Council, my understanding was we had to restate that so that was not lost in the event that there were any duties in between those timelines. So that's just existing law today that we're consolidating in this one code section. There are 2 other effective dates within the bill. At the very end of the bill, you'll say that none of the provisions become effective until October 1st of 2019. So that, when the bill is signed and then when you reach October 1st, 2019, the applicant provisions would become effective for applicants who are going to new licensed facilities. And the caregiver registry would be available at that point in time as well for the public, for private employers for their family members. The existing employees could start at that point in time at the employer's discretion. However, there is another date in there that says they have until January 1st of 2021 to do existing employees. And the thought there is that we need a phase-in, exactly to Representative Petrie's point, to allow time for those employers to send their folks to get their fingerprints and get a response and get it back. And we don't want to have everyone rushing to do that at once. If you have 50,000 folks out there to do this, we want to allow that 2-year window so that it can be a gradual process. That's what happened in the child care industry, to my understanding. That was the chart that was provided by GBI, and seems to be the most prudent way to proceed.
Thank you. And then just one follow-up question, just to increase my understanding of the fingerprints, the actual data that is stored from the fingerprints. Can you help me understand if they are the actual fingerprints or if they're the biometric data?
So Certainly, it's biometric data. I think you can do a card print, to my understanding, and send that up. But what we're talking and speaking of here specifically is you would go into a UPS store and they would have something that, to me, is akin to a copier, and they roll your biometric print onto that, and it electronically captures it, sends it to GCIC, and then up to the FBI for a check. Once it matches that and returns the criminal history record to the department for review, my understanding is the fingerprints are then discarded. They're not retained. There's not a capacity to retain those, and that's the current process today.
Okay, thank you. Just want to clarify that not storing that data is very important. Thank you.
And Mr. Chairman, I just started listing the offenses. I can finish that list if you'd like. Since she asked that question, it'll take me 30 seconds. I mentioned
Proceed.
at line 84 through 89 already, actually through 88 already, but 89 is a sexual assault crime. 90 is failure to report abuse of an elder. Then you get to the felony offenses starting on line 91. 92 there, it lists all the theft felony offenses and also controlled substance abuse offenses. Line 93 is a criminal attempt felony. 94 is a smash and grab burglary felony. And line 95 is, I think it's operating unlicensed personal care home. So those are the offenses we have listed in the bill.
All right, thank you. Representative LaHood.
Thank you, Mr. Chairman. Thank you, Senator and Deputy Commissioner. I just want to go on record and point out that, well, first, I am in favor of the intent of the bill, and I appreciate you bringing it to us. But I did want to point out this is an unfunded mandate to a private sector industry that is keeping people off government-funded long-term care programs. And so this is an added financial burden, and not only financial, but an administrative, operational process to get these live scans done. So with that said, I just my point being, I have personal experience with getting my biometric fingerprints checked. I've sent employees to have theirs done, and access is a problem, and we've acknowledged that. I don't want to beat a dead horse, and there's a plan to improve access, but right now it's not good. We've mentioned UPS stores. I've seen them in auto parts stores, and if we send an employee to one of these live scan sites and the owner of this store is on his lunch break, then they're out of luck. They have to go and come back another time, take another gamble on if they're going to be there or not. So to wrap all this up, in summary, my point is that to go on record and saying that the success of this is heavily dependent on the GBI and DCH getting this right and ensuring that we have access. And it is a little concerning to possibly pass this bill into law before it is right. So I just want to implore you to take it seriously and make sure that we ensure access and control the cost from skyrocketing, which would pass the burden on to private sector industry and consumers. So I appreciate you talking to that.
Yeah, it's a team effort for sure, and that's why it's important the way the bill is laid out. We have the delay in the implementation of this, the effectiveness of this. That way we can make sure we get this done right. And hopefully, there's all kind of mandates we have from the government already in certain industries. What we're doing here, hopefully, is protecting this industry by making sure we have these protections in place to hopefully avoid more lawsuits based on this. And of course, the bottom line at the end of the day is also protecting those that y'all are caring for in this industry as well. So I think it's going to be a team effort, but sometimes you do have to pass the bill to implement all this and have the delay in implementation and watch this and make sure we get it done right as we go. But you have to get this process started as well. So appreciate it.
Representative Yin.
Thank you, Mr. Chairman. Can you clarify for me again? I wanted to make sure I understood this correctly. So if a provider, if people follow this procedure and they get the background check, and does that free the provider of any liability?
It would based on a claim for negligent hiring based on the background check itself. So Reliance, basically you couldn't be sued saying, well, this person had this offense on their record, you shouldn't have hired them. You've now relied on a fingerprint-based system to make sure, versus right now, you're gonna rely on someone's word basically, and the state system doesn't have everything. Now you're completely relying on this national database. So through that, you can't be sued based on that reliance.
And what's the enforceability mechanism for it?
Well, it's an immunity, so if someone were to sue you, it'd be something you'd have to file a motion to dismiss, and there's no way you can move forward with the claim. So someone can always file lawsuits, obviously, but this is one of those that'd be a quick motion to dismiss because it's clear immunity in the code.
Oh, I'm sorry, not the enforceability with the lawsuit, but the enforceability with the procedure itself. Just ensuring that if we pass this mandate, how are we sure that the facilities are actually doing it and following it?
And that's, you want to speak to that?
So the Department of Community Health licensed all of these facilities, and the basis for bringing this bill is part of the licensure procedure.
Okay.
So to maintain their license, or if they were a new facility, they would have to show that they've demonstrated this. The department will review that. We go out on periodic surveys of facilities or provider types, and one of the things, once this law passes and is effective and in place, those surveyors, when they would go out, they would look for an employment file to show that you have indeed done this process for an employer who's applicable.
Thank you.
Representative Petrie.
Okay, thank you again, my friends. I had a couple of things I just want to tie up to make sure that I'm getting some, there's a lot of industry folks here in the room that are concerned about some of these things. Couple of issues. There is an issue, and Representative LaHood just spoke to the cost, but there might be some things we can improve upon. Currently, my understanding is the Department of DBHDD, which does require fingerprinting for all the caregivers currently, that needs to be said, is already doing that. Now DCH will be doing that. Can you help me to understand if providers who are hiring aides who work for multiple, the departments don't matter to the private sector, as Representative LaHood speaks to, it doesn't really matter. We're taking care of folks. And so you literally may now have a situation where every aide has to be fingerprinted twice. Can you speak to what you can do to fix that and to change that? That would reduce a burden on the private sector. Okay, that's my first question. I have one more, Mr. Chairman.
Yes, sir.
So, go ahead. So in this bill today, actually in present law, that duality exists.
Yes.
For community living arrangements, which are primarily overseen by the Department of Behavioral Health through a contractual process. Because what happens there, to my understanding, is DBHDD contracts for providers, and then they have the funding and to enforce that contract. So through that contract process, they require a fingerprint process for community living. However, DCH actually has the licensure and oversight for that, and in law today, there is a process, not the fingerprint background, but it is the name check that we were talking about replacing that is also consistent. So in law today, you have the duality. This bill will fix that, because what we've done is when we consolidated these bills, we eliminated the community living arrangement from being applicable to DCH for the fingerprint background check. And the reason for that was DBHDD was already doing that. We were trying to make sure that a provider did not have to go through two processes because of how we're structured in the state for that facility type. So if you pass this, that's what will happen. Our new admin rules would eliminate the community living arrangements from being under the DCH process. You'd be solely under the DBHDD process. That also goes back to an earlier question, just to maybe tie that up. That's why we're not trying to do the ones that are already under the purview of the composite board, and the nursing board, and through the pharmacists and the dentists. They have their own licensure process through the Secretary of State. We don't want to replicate that. We're simply trying to do this category.
And Deputy Commissioner, that one of the reasons I asked this, you and I have discussed this before, and I wanted to emphasize, and I appreciate how much I appreciate trying to remove this duplication. We should, the bureaucracies of the state should be thinking about ways to do that, and you have. But my question is, you mentioned the residential side. So as it relates to home care, which of course is the overwhelming majority of home and community-based services in this state, home care providers, which are not facility-based, are in this bill as well. But you have aides serving DBHDD and now will be serving DCH side of the house. Are we eliminating that duplication as well?
We certainly will in the administrative process if
Okay.
there's one-offs like that. Community living was easy in some respects
Sure,
because
sure.
it was a whole class. If there are one-offs, then we
Excellent.
certainly will commit to do that during the administrative process because it's not
Fantastic.
our goal to, our objective to do both.
And you had explained, and I appreciate it so much, you were thinking about this ahead of time. And but that is, just want to emphasize how important that will be to maybe offset some of the costs that have been alluded to today. Eliminating that duplication would be an enormous fix, but having every aide fingerprinted twice would really be ridiculous. I think we all could agree that would be a fundamental. Last question. I just want to emphasize and make sure we've had this conversation, but want to emphasize these fingerprints will not be required annually for every caregiver.
No, and I'll
Just
be
want
happy
to
to
emphasize.
address that.
Yes,
Originally,
please. I think that's helpful. Thank you.
So this is only required one time in this bill. It's required for employees who have not undergone that process, and then it's required for new applicants. There's not a repeat for that if they have continuous employment. Now, if they change employers to another entity, then the law says that if you have not had a fingerprint check done within the last 12 months, that you would have to go and seek a new one for that new applicant employee. So that's the provision there. I think just to add on to that, the intent here also is to have that thumbs up and thumbs down for applicants so they cannot employer shop and take advantage of an employer either. So if they go and get a thumbs down and get rejected on criminal history and the department has that record of they were rejected by X, our intent is to have them to be able, the provider, when they go in and log in and do that check, that they can already see that person has been turned down so they don't have to expend that money again. Today, there's not a process to do that. You'd have to check that person again, and you may even hire them if you do a different process. So that we hopeful that will be beneficial as well.
Yes, it will be. Thank you. Thank you, sir.
And Representative Teague, did you have a question?
Yes. Good morning, committee and chair. And I tried not to disturb y'all while y'all were talking. I'm sorry. I should have gone up there. But my question, because I know the people don't make but minimum wage or whatnot, and they go from place to place, kind of somebody offer a little more money. So will they be able to, will they have to have a fingerprint each time they go to a different place to get fingerprinted, or how will that work?
So if they are changing employment, if they have not had a fingerprint check done in the last 12 months, then they will have to have a new one done. So, but if they have, then the new provider would be able to use that previous check for their records.
Okay, so that'll be something that's stored on a computer, saying whether or not the person had a criminal background.
What would happen? DCH will have a registry that the providers will utilize that they can log into to see is this person eligible for employment or not, and it will come back yes, no, or they're not in the system, and that's what they would be able to look at, and they would be able to see if they had previously been approved and if it was within the window or not, or if they were not in there at all.
So for my visual take on this, then so help me with this. So the doctors and nurses are licensed and they have. So we're just doing the people that are aides and assistants, even the people that cook. Right?
No, ma'am.
No, nobody that. Okay. But the reason I'm asking this question because I've read some information where the number of AIDS cases and the elderly has increased. And I said, well, they in a nursing home. But then they say, well, it don't make no difference. So, how, we're gonna keep tabs on, so some of the servers, the cooks and people like that don't have to have a background check. So my thing is they they said it's because of the reason the AIDS case, like, you're not a prison, they go and get these jobs, and then, they consensual, but it's just the idea. Everybody's not getting it.
But in the bill starting on line 118, we define what direct access is. And these are people who have direct access with the patients. And so we have a clear definition of what that means. So anyone that's got that access would be covered. But a typical cook, as you said, I'm assuming wouldn't necessarily be working directly with a patient. But if they were working directly with them, they'd be caught up in this too.
Thank you. Representative Bonner.
At the appropriate time, Mr. Chairman, I make a recommendation to pass.
We have a recommendation to pass. Second. We have a recommendation and a second. All in favor, say aye. Aye. All opposed? So noted. Thank you, and very good.
Thank you, members of the committee.
All right, thank you. And who is carrying your bill?
Representative Estration is carrying the bill.
Okay, all right, very good. Well, Chairman Cooper, if you would like to say a few words to the committee, please do so.
I want to thank the committee, and I'm sorry I sound like a frog, for this vote. I don't know why I've become the person that's sort of a point person for the elderly in moving a lot of the bills in the past few years. Maybe it's because there's a lot of white hair under this hair color. But it is a situation that's near and dear to my heart. You know, they say, and Representative Fry came close, that the health of a nation depends on how we take care of our most vulnerable citizens, and that would be our children and our elderly. We've come a long way in child development. And I talk to you because as you go forth talking to your colleagues, is why I wanted to address the group, is that on elder abuse, we've been way behind the 8 ball. It's rampant. It's growing. It can happen to your mother or your father. It's everywhere, and it's not pleasant. It's not just taking a little money from them. It's cleaning out everything they've saved for their life, or it's physical abuse. The really high-profile cases, have you seen them on the news lately, where nurses laughed while a patient died in a nursing home? Now, I have great respect for the nursing homes in this state, and they take care of thousands and thousands of patients across our state, most of them on Medicaid, the largest percentage, and a few on Medicare. These are the ones in that issue. And overall, they do a really good job. But society is changing. It's happening in nursing, and it makes me sad to see my profession when a registered nurse would sit and laugh while a patient died. They took away her nurse's license. As far as I'm concerned, she is now, thanks to the DeKalb prosecutor, going to be prosecuted. They could put her in prison and throw away the key. I can't think of anything more terrible to see somebody suffer and die. But that registered nurse lost her license. And what she did is try to go back and go on this, certified nursing assistant registry so that she could work in a nursing home. Luckily, they caught her. And I think it was due to all the information. But people are changing in our society, and that there are many that have no respect for life. And they have seen our nursing homes as an easy target because they are some of the lower places to go. So we take baby steps down here sometimes, and we've been taking a lot of first steps. And our state is being recognized now for what we're doing and trying to change on elder abuse. And this is a major first step. And I so thank you for doing this. I work with Commissioner Keenan, Director Keenan, all the time on these issues. And I can tell you, he's a man of his word. When he tells you that he will get these places set up so that people have no trouble getting their fingerprints, he means it. And I'm on the Rural Council, and I will tell you the rural people have done surveys, and people in rural areas are willing to drive 100 miles every day to have a job. 100 miles. So I think they may not like it. They'll be willing to drive 25 miles to get a fingerprint. And I know that nursing homes and private employers like Representative Hood, can be creative. If they don't want to cover the whole cost, I know in the past in some places they've taken $15 or $10 out of the person's paycheck over a 3-month period. Now, I'm not suggesting that, Representative. I'm not suggesting that. But I can tell you that there are ways. And nursing homes are taking care of sicker people now. Hospitals are being forced to push people out quicker. Those people are now going to the nursing homes, or they're being pushed into home care. So they're even more vulnerable than they've ever been. And we need to do everything we can do to protect them. I thank you for being so thorough. I thank you for bringing this bill. And there are 2 other bills I hope you will support moving through. One of them is when in the personal care homes, they take the person's money and then shift them to one place or the other. Wendell Willard has it. It's called trafficking, and that's what people are doing. And then I have one to work with the district attorneys to set up groups where they work with the police and everybody involved in elder abuse so that they can learn more about it. Because if you and I will close, if you remember, the DeKalb police did not know in the case where they laughed and carried on about the person dying, whether that was elder abuse or not. They did turn it over to their DA to decide. And that's not, I mean, I don't fault them because lots of people across our state and our law enforcement don't know what elder abuse is. And that's one of the things we want to do is educate them so they'll know. So thank you I've been a long meeting. Thank you for letting me speak and for listening to this frog voice. But I'm telling you, people are watching us. I get the calls all the day, and they want to know that their loved ones, and most people think that we're already doing the fingerprint checks on a national basis for everybody working, and they are appalled. Your constituents and mine are appalled when they find out we haven't been doing it. So this is something you can be proud of and take home during this season. Thank you very much for letting me speak.
Thank you, Chairman Cooper. All right, we are dismissed.